All right, good day. Dr. Michael Valentine here, talking about signs and symptoms of thyroid problems. And the key thing that we want to focus on is that many thyroid problems don't happen, or are not diagnosed, I should say, that's a better way of putting it, are not diagnosed for 10, 20, 30 years later. But the signs and symptoms are there much earlier, so that's why we kind of want to focus on the signs and symptoms. So what you want to look at is there any family history of thyroid problems? Mother, aunts, uncles, those type of individuals, so that we got the genetic predisposition here for the thyroid. We also want to look at, okay, the neck. Is the neck a bit thicker, wider? Does the individual have what we call a dowager's hump, which is that hump right back here? And that's also known as a widow's hump. That's another sign or symptom that we see. The third thing that we see, which is quite common, is that the individuals had some degeneration in that cervical spine in their neck, and that's specifically at the C4, C5, C5, C6 level. And those are the nerves that communicate to the thyroid gland. So we have a family history, we have a thick neck, we have a dowager's hump, okay, dowagers, and we have some cervical spine problems. Now let's say that you don't have any genetic predisposition, that also that we've noticed is that possible a concussion. So someone that's had some type of head trauma then develops a thyroid problem. We've seen this where there has been no family history, no genetic predisposition whatsoever, but they had a concussion, and that concussion affected the brain. And then if you look at one of our other parts of the talks, you'll recognize how that hypothalamus becomes a key player in affecting that communication, the pituitary, and then affecting that thyroid gland to produce the thyroid hormones. So, thick neck, dowager's hump. What other things? Well, how about dry skin? How about thinning of the hair, brittle hair, loss of hair, of course. Another factor is menstrual cycles, problem with menstrual cycles, problems that you've had. Maybe you thought that was normal, or you were, for women of course, put on birth control pill because your menstrual cycles were so bad. My wife actually had that, and that's what they did to her, and then of course, you know, come to find out she had a thyroid problem. Endometriosis, another common thing that develops. Erratic menstrual cycles, which is real common. How about energy, fatigue, brain fog? Those are big issues. And then of course, we will have tendency towards constipation or bouts of constipation and diarrhea, which is also known as IBS, irritable bowel syndrome. So we see a lot of that. The thyroid gland is really a protector. The thyroid gland is involved in our immune system response, and you probably have read about iodine being a key player. But I don't recommend that you take iodine because you really want to find out what's the cause of the problem. Iodine can put you into an autoimmune component type of problem. So we don't want to have that happen. Let's see, thinning of hair. Eyebrows, outer third of the eyebrows, loss of the outer third of the eyebrows. Lack of motivation, we hear so much. And then depression, anxiety. There's always a reason why. And that's what we see a lot of, the depression, the anxiety, the bloating, the gassy indigestion. So I'm not able to fit all those different things in here, but you kind of get an idea. There's a lot of signs and symptoms associated with the thyroid issue, and what I'd recommend is go to our Facebook site. You can always go ahead and participate on that, SoCal Thyroid Doc. Okay, and please comment on the videos. If you like this, you know, we try to make these videos so that you get an understanding, educate. We're seeing more and more thyroid problems. We're seeing people that are on the thyroid medications, whether it's a levothyroxine, Levoxyl, Synthroid, Armor Thyroid, Nutraceuticals, and they're still feeling bad. Remember, just because you're on a thyroid replacement hormone doesn't mean that your thyroid's being fixed. You can always contact us at 714-964-9566. Dr. Michael Valentine.